Hello and welcome. Today we're going to discuss a serious condition affecting the kidneys, renal vein thrombosis, or RVT. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. Renal vein thrombosis occurs when a blood clot forms in one or both of the renal veins. These veins are crucial. They drain blood away from the kidneys after the kidneys have filtered waste products. A blood clot obstructing this flow can have significant consequences. Several factors can contribute to the development of RVT. These include conditions that make the blood more likely to clot, such as nephrotic syndrome, a kidney disorder that causes the body to excrete too much protein in the urine. Other potential causes include trauma to the abdomen or flank. Certain cancers, especially renal cell carcinoma, infections of the kidneys, pregnancy, dehydration, the use of oral contraceptives, and inherited clotting disorders like factor V Leiden or protein CNS deficiencies. Sometimes RVT can occur without any identifiable underlying cause. This is termed idiopathic RVT. Now let's delve into the pathophysiology. When a clot obstructs the renal vein, the flow of blood exiting the kidney is blocked. This causes a backup of blood within the kidney, leading to increased pressure in the renal capillaries and veins. This increased pressure can damage the kidney tissue, specifically the nephrons, the functional units of the kidney. Reduced blood flow and damage to the nephrons impair the kidney's ability to filter waste and regulate fluid balance. Over time, this can lead to kidney dysfunction and, if left untreated, kidney failure. The sudden blockage can also cause swelling and inflammation of the kidney. In severe cases, the blockage can lead to renal infarction, where the kidney tissue dies due to lack of blood supply. The epidemiology of renal vein thrombosis varies depending on the underlying cause and population studied. RVT is relatively rare in the general population. However, it is more commonly seen in specific patient groups, particularly those with nephrotic syndrome. In patients with nephrotic syndrome, the risk of RVT is significantly increased, estimated to be anywhere from 5% to 40%, depending on the severity of the protein loss. RVT can also occur in infants, especially those with dehydration or those who have undergone umbilical catheterization. The exact incidence in these populations is not well defined, as RVT can often be asymptomatic and go undiagnosed. While data is limited, it appears that RVT affects men and women equally. Recognizing the signs and symptoms of renal vein thrombosis is crucial for early diagnosis and treatment. However, symptoms can vary widely, and in some cases, RVT may be completely asymptomatic, especially if it develops gradually. When symptoms are present, they can include flank pain in the side of the body between the ribs and hip. Hematuria or blood in the urine is another possible sign. Proteinuria, the presence of excessive protein in the urine, can also be an indicator, particularly in patients with nephrotic syndrome. In some cases, RVT can present with a sudden onset of kidney dysfunction, leading to decreased urine output, swelling of the legs and ankles, edema, and high blood pressure. Rarely, RVT can be associated with pulmonary embolism, a potentially life-threatening condition where a blood clot travels to the lungs. Diagnosing renal vein thrombosis requires a combination of clinical suspicion and imaging studies. Due to its variable presentation, RVT can sometimes be challenging to diagnose. If RVT is suspected, the first step is often a review of the patient's medical history and a physical examination. Urine tests can reveal proteinuria or hematuria. However, the definitive diagnosis relies on imaging techniques. Computed tomography angiography, or CTA, is commonly used. It involves injecting a contrast dye into a vein and taking X-ray images of the kidneys to visualize the renal veins and identify any blockages. Magnetic resonance angiography, or MRA, is another imaging option that uses magnetic fields and radio waves to create detailed images of the renal veins. Renal venography, an invasive procedure where a catheter is inserted into the renal vein and dye is injected, is less commonly used but can provide detailed information. Ultrasound, particularly Doppler ultrasound, can also be used to assess blood flow in the renal veins, but it may not be as accurate as CTA or MRA. While renal vein thrombosis doesn't have distinct types, as such, it can be classified based on factors like acuity as acute vis chronic, laterality unilateral vis bilateral, and the presence or absence of underlying conditions. Acute RVT refers to a sudden blockage, while chronic RVT develops gradually over time. Unilateral RVT affects only one kidney, whereas bilateral RVT affects both. It's also important to classify RVT based on the presence of an underlying condition, such as nephrotic syndrome or a clotting disorder, as this can influence the treatment approach. The primary goals of treatment for renal vein thrombosis are to prevent further clot propagation, relieve symptoms, and restore kidney function. Anticoagulation therapy is the cornerstone of treatment. This involves the use of medications like heparin or warfarin to prevent new clots from forming and to allow the body's natural mechanisms to dissolve the existing clot. The duration of anticoagulation therapy varies depending on the underlying cause of RVT and the patient's individual risk factors. In some cases, anticoagulation may be lifelong. In severe cases of acute RVT, thrombolysis or clot-busting therapy may be considered. This involves administering medications like TPA directly into the renal vein to dissolve the clot. However, thrombolysis carries a higher risk of bleeding complications. In rare instances, surgical thrombectomy or surgical removal of the clot may be necessary. This is typically reserved for cases where other treatments have failed or are contraindicated. If the RVT is secondary to an underlying condition like nephrotic syndrome, treatment of the underlying condition is also essential. Preventing renal vein thrombosis involves managing risk factors and taking proactive measures. For patients with nephrotic syndrome, controlling protein loss through medication and dietary modifications is crucial. Adequate hydration is important to prevent dehydration, which can increase the risk of clotting. Patients who are at high risk of RVT, such as those with inherited clotting disorders or those undergoing major surgery, may benefit from prophylactic anticoagulation to prevent clot formation. Avoiding prolonged periods of immobility can also help reduce the risk. If you are at risk, discuss preventative strategies with your doctor. The prognosis for renal vein thrombosis varies depending on the extent of kidney damage, the underlying cause of the RVT, and the effectiveness of treatment. Early diagnosis and prompt treatment with anticoagulation therapy can significantly improve outcomes. In some cases, kidney function can be fully restored. However, if RVT is left untreated, it can lead to chronic kidney disease and eventually kidney failure, requiring dialysis or kidney transplantation. Recent research has focused on identifying novel anticoagulants with fewer side effects and on developing more effective thrombolytic agents. Studies are also exploring the role of genetic factors in the development of RVT, which may lead to personalized prevention and treatment strategies in the future. Thank you for joining us today. We hope this overview of renal vein thrombosis has been informative.